May is National Stroke Awareness Month. Nearly 65,000 people in the United States will suffer a stroke this month alone, making it the leading cause of disability and the fifth leading cause of death in America. But despite these startling numbers, there is some good news. Most strokes can be prevented if you know the warning signs and you act fast. Here to share more about stroke prevention and survival are Dr. Dileep Yavagal, interventional neurologist with the University of Miami Health System, and his patient, a stroke survivor herself, Isabel Sullivan. Thanks to both of you for being here.
Thank you, Pam.
Great to have you. So, doctor, let's dive in. Let's talk about what a stroke does to your body. What's going on?
Stroke is a sudden event in the blood vessels of your brain, and there are two types. The most common is a sudden blockage that occurs, and this is the case in about 85% of all strokes, and the blood flow is cut off. The other type is actually a bleeding kind of stroke that's about 15%, and a small portion of that is from aneurysms that bleed. But the most common type of stroke now has new treatments that can actually reverse the damage.
So let's talk about that for a moment. One of the things you and I discussed earlier that is so important is noticing that these symptoms are sudden. One moment you're fine, and then the next, all of a sudden, you can't speak, or you have numbness, or some sort of paralysis, correct?
That is correct.
Okay, so then what should you do next? Obviously, if you're somebody who's debilitated because you're the stroke victim, what do people around you need to do in order to get you that help quick?
That's the most important thing that we want to convey, is that time is brain. And if the person near you, or if you're capable of recognizing it yourself, has sudden loss of balance, sudden vision difficulty, sudden face drooping, sudden arm weakness, or sudden slurring of speech, then it's time to call 911. So that is a nice acronym to remember: be fast.
Be fast. Okay.
And the big problem is stroke is painless. So the natural reaction a lot of the times is to wait it out or sleep it off. But if you see be fast, then you have to be fast. And the EMS is now extremely well trained to recognize a stroke, because we can do so much about it and reverse these symptoms.
And do it more quickly than before. Before we get into that, and we know time has changed from the 6 hours now to 24 hours, I want to bring Isabel in here and get your story. You're so young. You're only 29 years old, and you had your stroke, you said, when you were 26, correct? What happened? Walk us through what was going on with you.
So I was a healthy individual. I worked out, I ate healthy. I had low blood pressure, which is the opposite of most stroke cases. And suddenly one morning, like Dr. Yavagal said, it happened very suddenly. I went to go throw something in the trash, and I had all the symptoms. I lost balance, my eye vision got blurry, my arm, my whole right side was paralyzed, my face drooped, and I couldn't talk. Unfortunately, my boyfriend at the time, who's now my husband, recognized the symptoms, called my mother-in-law, and she urged him to call 911, and he did, and that is what saved my life and what opted for my miraculous recovery.
You had to be so frightened when that was happening with you.
Actually, I wasn't.
No?
I wasn't. My natural reaction was to laugh. I couldn't stop laughing. And that's why my boyfriend was so confused. He was like, what's happening? I was laughing. I told him I wanted to take a nap.
Oh, wow.
So it's scary for other people. I think for the individual that is undergoing the stroke, it's not that frightening. But you know, I had a miraculous recovery, so I'm very fortunate.
So you were rushed to the hospital. Doctor, that's where you come in. So take us through what happened next.
So the system has been modified to really help someone like Isabel make a full recovery if we can get to her in time. We call it the stroke chain of survival, or the stroke protocol in the community. The EMS recognized that she was having a stroke right away and brought her to the nearest comprehensive stroke center, which was Jackson Memorial. And when they bring them, we get pre-notified. So we met her at the bay and even did not let her go to the ER bed. We take patients like her straight to the CT scanner. We saw that there was no bleeding, because this treatment that is new is for the most common type of strokes where there is a blockage.
Okay.
We saw the blockage rushed her to the angiography suite, which is the operating room for this new procedure called mechanical thrombectomy.
What is this that we're looking at right here? It says before and then after. So this is the before. That's the clot.
That's the clot that's blocking her artery. So it's not the clot you think of where there's a bleed in the brain. This is actually the clot that's inside the artery, the white straight line. That is where the blockage is in the blood vessel going to the left side of her brain. And we saw that, and we do a test called CT angiogram to prove it 100%. But this was so obvious that we rushed her without even doing that, because even minutes can make a big difference. And so we shaved off those minutes, brought her to the angiography suite. We go from the groin, because we want to enter the arterial highway through the groin artery. And in the angiography suite, we use advanced X-ray navigation to bring up microcatheters, which are 27,000th of an inch, and they're very navigable, and we take them over 14,000th of an inch wires all the way to the blockage.
That's amazing.
Yeah, and that allows us...
Is this an animation of it?
That's it. That's the wire going through the clot in the artery, the white that you saw on the CAT scan, and then we bring up the microcatheter, which then allows us to bring up this device. The one you're seeing is called a stent retriever that acts as a fishing hook to engage that clot that's blocking the artery.
Wow.
And once we wait for about 5 minutes, the clot is engaged, then we start bringing the device and the clot out of the artery. And we bring it all the way out through the groin and restore blood flow.
That's amazing. So even that 5-minute period, though, the blood flow hasn't been restored yet.
So
is
actually,
that dangerous, or
no? Actually, it gets restored because the device pushes the clot away.
Ah, okay.
So if you notice in the animation, you actually see blood glowing. So even those 5 minutes, the blood is already flowing.
Walk us through time, because it used to be that you had to, if somebody was having a stroke, they had a really short window of about 6 hours. And then after that, and you were saying there have been some cultures, or there was a theory of thought that, oh, you had a stroke, that's it.
That's it.
No recovery. But you're saying it's even beyond that. Now we can go to 24 hours, correct? Because of this new procedure.
Correct. So in 1995, the clot-busting medication was proven to help stroke, but it was only up to 3.5 hours. And 3.5 hours is a really short time, as you would agree. That got extended to 6 hours in 2015. So it took almost 20 years to get something that extended that window, and that was a procedure called mechanical thrombectomy, which you saw. But we did not see how we could go beyond 6 hours, because a lot of the brain tissue dies. But just in 2018, that it got extended 4 times to 24 hours, because in clinical trials that we participated at the University of Miami, we proved that if you use a special type of CT scan called CT perfusion, that scan can actually identify brain that can still be saved, even beyond 6 hours. And a significant number of patients, especially the ones who wake up with stroke, can have a lot of brain that can be saved by this procedure.
Yeah, because some people have it while they're sleeping.
Correct.
Right. Isabel, I know you've also sort of been mentoring people who have had strokes, right? What do you tell them?
Well, the first thing, my first initiative is to help prevent strokes. So it's the Be Fast acronym. It's to be aware, to know the symptoms, to tell everyone you know about the symptoms, and to spread this awareness. That's the purpose of the show today. And then for people that have undergone strokes, I tell them to stay in the recovery, to do rehabilitation, that you do see results. And it may take a while, but you will get there. And any kind of improvement is a big improvement.
And how are you doing?
I'm doing great. I actually feel phenomenal. I still work out, I still eat healthy, and I live a healthy lifestyle, and I'm able to walk and drive and do all the things that I was doing before the stroke. So as I said, my case is a miracle, and not everyone is as fortunate as I am. But there's a community of support, and I think that for all stroke survivors, we're all here for you. We're a big community, and there's a lot of love and trust between us all.
Thank you both so much for being here. Such an important topic, Stroke Awareness Month. I think we may have saved some lives today by educating people about it. So thank you so much.
Thank you, Pam.
You're welcome. Thank you.
And for more information on stroke warning signs and prevention, visit strokeassociation.org. We'll also have this information and more for you on our Facebook page at Your South FL.